Today, I want to show you exactly how I help people with vertigo or dizziness. What is it that I do? What does the adjustment look like? So stay tuned so I can show you. I'm Dr. Matthew Posa, and I'm a corrective care chiropractor in Milton, Ontario, Canada. I help people get over their spine-related health concerns so they can live the life they were designed to live. If you like this content and want to see more, make sure to subscribe to my page and don't forget to click on the notification bell so that way you get informed as soon as my next video drops. The first step that we take with any new patient is we go through their health concerns. We want to know what they've done, what they haven't done before. After we've gone through their health history and we get a really good insight of what's going on, really what I'm trying to determine as a doctor is whether or not they should be in this office. The majority of the people will have associated neck pain. So right away that ticks the box saying that there is a problem and we do need to look into the neck. What we do after we check physically, so we do a physical check, is we use something like this. So this here is a scanner. So it's got two thermal scanners on either side of the spine. And what happens is we bring this up the back. And as we bring it up the back, it's measuring left and right of the spine. And your spine has a tolerance. So there's a normal heat signature up and down your spine. When the spine is even, then usually that's okay, there's no problems. But as soon as there's a variation in the heat difference at a specific level, that tells us that usually one of those joints are off. So when you look at a spine from the side and we look at the joints, if we notice that anything is this way or it's to the side, so it could be sideways or it could be rotated, there could be a few different variations of this. Well, once we determine that there's obviously something wrong at that level and we have a measurement to that, so that would be your baseline, then what we do is then we follow that up with an x-ray. Now the x-ray really determines what's going on. Are you straight? Are you crooked? Is there issues there? Is there even things like degeneration, arthritis? Are there other conditions associated with this? Is this safe to do? So that would be a big thing. But once we've determined and we ruled all that out, now we're measuring things. So this is what that looks like. We're looking at this x-ray, we're seeing what the imbalance is, and what you'll see in the top left corner is that there's actually a listing. So that is, after I've gone through everything, I found that there is a problem, it is rotated, it's off, and there's a listing there. So that allows me to do the adjustment. Now that we have a baseline, we have testing, we've done history, we've now done x-rays, we have everything. When everything lines up, then this is a good case for chiropractic, this is a good case for correction, and that's when we would do the first adjustment. When they come in, they lay down, what you're gonna see is I'm gonna start at the feet. We're seeing if there's an imbalance. In this case right now, there is an imbalance in the feet. And when we turn the head left or right, we notice that turning the head one way actually created balance. So turning the neck created balance in the feet. So that shows you how even an issue in the neck, how it can transfer all the way down. But now this person's laying down, we're gonna do the adjustment and you're gonna see that right now. Now what's really cool about this is that we will do a post-adjustment scan. So that means after their adjustment, we're gonna rescan the neck and we're gonna be able to see those results immediately. So it's not necessarily a change in the symptoms, so the vertigo or the dizziness. It doesn't mean that it just stops right away and it goes right away. What it means is your body is now in a position to heal. We've taken the pressure off the nervous system and now the brain and the body can do what it does best, which is heal. So that's what this looks like. Here's an example of the post-adjustment scan. This was exactly that adjustment. These were the pre-adjustment scans, so you can see this right here. So you can actually see that change. You can see the colors are different. You can see where the pressure is different. And so we've changed the nervous system, we've calmed it down, and this is a healing now environment. What I also want to show you is a different way of doing the adjustment. There's a lot of different ways of doing an adjustment. This other way of doing the adjustment is one of my favorites because it not only is very specific, but it is more of an old school upper cervical type of adjustment. So this one is done extremely quick, so that way it's not done hard. And that's really the difference, is it's a very quick adjustment, but it is not a hard adjustment. For those of you watching, you might not understand that until you experience it, but really what's happening is the table has a drop mechanism, and when the table drops, then that's what's actually taking place with the adjustment, and all my hand is doing is following through. versus me trying to push the joint through. So it is actually a little bit more comfortable, and it's actually lighter for a lot of people.
Fairly quick.
So I hope that sheds a lot of light for those of you who have vertigo or dizziness. This is an approach that obviously I take every single day. This is something that I do to people all the time, and we see results. But really the quality of the results really comes from the analysis before. It's making sure that we are correct in our analysis. It's making sure our measurements are correct. And it's the level of precision that allows us to get there. And if you live in Milton, if you live in around this area and you want that level of precision, then please reach out. If you need and you want to find somebody that does similar type of chiropractic, then you can leave a comment down below or reach out to me personally, and I will do always my best to get you in the right hands. I cannot though diagnose people over the phone, over email, and anything like that. So please don't send me stuff. I have been getting a lot of stuff, and my college doesn't allow us to do that. You want a little bit more on the other videos that I've done, I'll just put a link right here so you can watch that video. You can see a little bit more about nutrition and what else you can do in order to help your vertigo.